Hey everyone, I'm Nicole Hodges and I'm a wildlife ecologist with the Department of Wildlife, Fisheries and Parks. I'm also a board member of the Mississippi Bat Working Group. In this segment, I'll be discussing the diseases that affect bats and the ones that affect bats and people. The first disease I will discuss is white nose syndrome. White nose syndrome is a fungal disease that is decimating the bat populations across the United States and Canada. Since its introduction in 2006 in Howell's Cave near Albany, New York, it is estimated that over 6 million bats have died. Some caves and mines are losing 90 to 100% of their populations. Populations of the little brown bat, the northern long-eared bat, and the tricolor bat have declined by more than 90% from white nose syndrome in the past decade. This is said to be the worst wildlife die-off in American history. This is a map showing the spread of white nose syndrome over time. Over a 13-year period, white nose syndrome has spread to 34 states and 7 Canadian provinces. There is also evidence that the fungus that causes white nose syndrome is present in California, Mississippi, Montana, and Wyoming. The fungus has been detected in 8 counties in Mississippi, but no mortality events associated with the fungus has been detected. We think this is because we have such mild winters that the insects are available year-round. The causative agent of white nose syndrome is Pseudogymnacus destrctans. This is a newly identified fungus that is slow-growing with optimal growth at 41 to 57 degrees Fahrenheit and a humidity greater than 90%. The classic presentation of bats diagnosed with white nose syndrome is a white muzzle, but you will see the fungus growing on other areas of the body as well. These pink areas on the forearm are from scarring. You can also see, with the help of backlighting, multiple areas of depigmentation with small pinpoint areas of necrosis, as indicated by the white arrows in the top picture. The black arrows in the bottom picture shows where the flight membrane has sloughed from necrosis. The fungus can also be fluoresced with a black light. The orange-yellow fluorescence in this image is the fungus. Scientists have developed a detailed explanation of how white nose syndrome is killing millions of bats in North America. This flowchart shows the breakdown of how the disease progresses from initial infection to death in bats during hibernation. So basically, the fungus colonizes the skin of the bat. This causes the bat to go into respiratory acidosis. And basically what that means is that there's high levels of carbon dioxide in the blood. This causes the bat to start hyperventilating, and when this happens, it causes the bat to become dehydrated and lose fat reserves. As wing pathology becomes more extensive and severe, these effects are exacerbated by water and electrolyte loss across the skin, which stimulate more frequent arousals and create a positive feedback loop that ultimately leads to mortality when energy reserves become exhausted. Many studies have been conducted to find treatment for white nose syndrome. Researchers have found successful methods of treatment in lab settings, but nothing practical to use in the field. So how can we help control the spread of white nose syndrome? We can wear PPE while handling the bats and conducting surveys and decontaminate between surveying sites. For specific instructions on white nose syndrome decontamination protocol, you can download this document online. Another way that Mississippi is trying to combat the spread of white nose syndrome, in addition to preventing vandalism and harassment of bats, is by building gates for our caves. We collaboratively worked with multiple agencies to garner funding and to provide physical labor to gate 2 caves in Mississippi. So the next disease I'll be discussing is histoplasmosis. Histoplasmosis is a fungus naturally found in the soil and is often found in bird and bat droppings. Humans contract this disease by breathing in the spores of the fungus. Most humans will not exhibit symptoms unless they are immunocompromised. Histoplasmosis isn't contagious, so it can't be spread from person to person. Symptoms of histoplasmosis include fever, cough, fatigue, chills, headache, chest pain, and body aches. This is an image of healthy lungs. Air looks black on x-rays and bones show up white. So this area here, these are the lungs, and these are healthy lungs. This is an x-ray of a person with histoplasmosis. The patient was a 56-year-old man who developed a cough and shortness of breath following heavy exposure of histoplasmosis while exploring a contaminated cave. Radiologically speaking, we call this a snowstorm effect. So all this white in what should be black is the fungus growing in the lungs. This is a histological slide collected from a nodule in the infected lung. The clump of cells here is the organism. For some people, the symptoms of histoplasmosis will go away without treatment. However, prescription antifungal medication is needed to treat severe histoplasmosis in the lungs, chronic histoplasmosis, and infections that have spread from the lungs to other parts of the body. Depending on the severity of the infection and the person's immune status, the course of treatment can range from 3 months to 1 year. Well, that's all I have for this presentation. Please check out my next video where I discuss viruses.